Right, so if you have read and understood, considering that history taking station, kindly begin.
Yes, ma'am. Good afternoon, sir. My name is Ajoy Abbas, a candidate, a SHO with the command. I've been asked to interact with you.
Yes.
Can you speak louder? I'm not hearing you very well. Okay. Good evening. I'm Mr. Smith, 28 years old.
Okay, Mr. Smith. May I know? May I ask what brought you to the hospital today?
Yes, I have a left knee pains in my knee since 3 months ago.
Yes, continue, please. Your time is clicking.
I think it's the one that is not talking, ma. Maybe it's out.
Hello?
Or his network.
Hello? Where did it? When?
Yes. I think he's not prepared for this patient.
Did it pain?
Got disconnected.
Yes, the pain is more on the left. Usually gets severe. Gets worsened as I'm walking.
Oh, so sorry about that. So sorry about that, Mr. Smith. Where does it move anywhere?
No, it's always at the knee. It's not moving to any other part of the body.
Okay. So when did you first notice it?
3 months ago.
Okay. So about that. What were you doing? Were you doing anything at the time when
No,
the pain started?
I wanted to stand up from my chair, then notice the pain.
Oh, okay. Sorry about that, Mr. Smith. Does the pain come and go, or has it worsened recently?
Yes, it comes and go initially, but in the recent time now, once I walk few distances, then the pain become more severe.
Okay, sorry about that. Is there any specific time of the day? How many blocks do you have to walk for the pain to get worse?
Maybe about 100 blocks.
Okay. So, is there any specific time of the day that this pain gets?
Yeah, it's usually worse at night. After my daily normal activities, usually more severe at night. Yes.
Oh. Is there anything you do that makes this pain less?
Yes, if I didn't walk much during the day, and then with some pain relievers given by my GP, the pain goes down. Hello.
That helps you and that makes the pain worse.
Yes, if I have to walk long distances or involves in jogging, I used to jog as a sportsman. I have to jog, so that one makes it worse.
Okay, sir. Sorry about that. On a count of 1 to 10, how was this pain? How worse is this pain?
Yes, I would score it 7. When it's as most severe, yes.
Oh, that's so sorry about that. I hope you are not it's not so bad at the moment.
Yeah, it's not so bad. We can continue, doctor.
All right. Okay. How badly is this affecting your day-to-day life? Can you carry out your daily activities?
It hinders me. It prevents me from doing my sport activity. Now I can't jog for long distance for long time, and then I can't be involved in sporting activities. I can't play my football again because of that.
That's so sorry about. Do you have any ideas about this problem, this pain?
I think it's likely maybe from the initial surgery that I had. Maybe it's the one causing it, or maybe another injury. I don't know, but I'm looking into the previous injury that I was operated for about 5 years ago.
Oh, I'm so sorry about that. Do you have any concerns about it at the moment?
Yes, I want what is causing the pain to be identified and then sorted out, so I can return back to to football. The season is just coming.
Don't worry about them, Mr. Smith. We are on it and we'll do our best to ensure you get the best care. Do you have any expectations from us?
Yes, that you solve this, you remove what is causing the pain. So that's my expectation.
We'll do our possible best to ensure you get the best care, Mr. Smith.
Thank you.
Do you have any skin lesions? Any rashes on your skin?
No.
Okay. Have you noticed that anytime when you try to bend or release your knee, it locks?
No.
Do you have fever or any discharge or redness around? Okay. Do you have any pain in your back?
No, not at all,
Okay.
doctor.
Do you have any numbness or tingling sensation in your legs or your feet? Okay. Do you have any darkening of the skin of your feet or loss of any of your toes?
No, doctor.
Have you noticed any weight loss?
Okay. Can
No,
you
I don't have weight
case
loss.
now? Please.
All right, thank you, ma'am. I would have loved to also ask about his past medical history,
Yes.
drug history, and family history. I'd have also loved to do a systemic review for him. However, I've seen Mr. Smith, who is a 28-year-old footballer who presented with history of worsening left knee pain, which over the last 3 months, for the previous history of surgery about 5 years ago, it was operated. He also the pain is said to be worse with prolonged ambulation and then worse in the evenings, and relieved by taking prescribed analgesics from his GP.
Okay, so what are your differential diagnoses that you'll consider?
Yes, ma'am. I think he possibly has an osteoarthritis of the left knee. It can also be heart pain from the hip or fracture of the left knee, of the tibia or distal femur. It can also be a septic arthritis or a rheumatoid arthritis.
How do you suggest to manage this patient?
Yes, ma'am. My intention is to investigate him further. So I fully examine the knee and then investigate him further. I would want to do an X-ray of the knee until both knees, anterior, posterior, and lateral, both in standing and weight-bearing position. And then I would also want to also do an MRI of the knee joint to further assess. The treatment will be initial. My intention to initially manage it can be non-operative, where I would like to encourage non-weight-bearing ambulation on the knee and to rest the knee for some time and elevate the limb while it's sitting down, and then give him analgesia. I'd also encourage knee strengthening exercises like swimming or cycling. Also, I would also encourage physiotherapy in him, and then heat application will also help to relieve some pains. If any analgesics, I would like to give kids NSAID and paracetamol, and then in severe case, and we want to give opiates, mild opiates or opiates, depending on the WHO stuff for that.
And if it fails,
surgically, I would want to. Yes, ma'am. Surgically, I would want to do arthroscopy, possible steroid injection in early cases, or go ahead and do a realignment osteotomy or a total or partial knee replacement.
Okay. When do you think this patient will be fit to play again?
It's not likely, ma'am. It's not likely because of the severity of the pain and the symptoms.
Yes. When do you think patient would be fit to play again?
Now, it depends on if it's early osteoarthritis. We can give him up to a year or two after resolution of symptoms. In severe osteoarthritis, you may not be able to play. You may require a total replacement.
Yes. So, for how long you'll ask the patient to rehabilitate himself?
Yes, ma'am.
For how long would you would you suggest?
I think about a year or two.
Yes, more than a year. 9 to 12 months at least. Yes. Okay, thank you. Dr. Kolade, would you want to give feedback first?
Okay, ma. Yes, ma.
Thank you.
Yes, I think he did very well. At least I was able
Yes.
to ask all the questions. The other ones I didn't, maybe also asking for any history of diarrhea that may suggest inflammatory bowel. I think he didn't ask. I think he
Yes.
asked for rashes, pain, and all those ones. Then the other thing he didn't ask for swelling.
Or stiffness. Yes.
Or yes, or stiffness or adenine. Then the diagnosis also, yes, it's osteoarthritis, but I think it will have been more complete to have put post-traumatic osteoarthritis, so that at least that shows and is more captivating, captured all the which type of osteoarthritis that the patient has.
He didn't ask. Yes.
Yes, yes.
And
Then,
any numbness, he didn't ask. Any locking.
no, he asked numbness, ma.
He
asked
did.
for the
Okay, I
numbness.
missed.
Yes,
I'm
ma.
sorry. Yes.
Yeah.
Locking of
Then,
the knee or some.
yes,
those
he
associated
mentioned
features.
he
Yes.
asked men, ma. Yes,
Yes.
he asked those one, ma.
Right. Good. And the things that he couldn't cover, he did mention in the case
Yes,
presentation.
indeed. Yes, sir.
So
Yes, ma'am.
he scored his marks over there, even when he couldn't ask you. Yes, during history taking. So he covered the marks over there. So yeah, he covered most of it. It was just the severity and yeah. Yes, more or less what you told. Good. That was a pass. Good.
Very much, ma'am.
And here is